Welcome DMEND TV. Do you know, dog bite it leave the bacteria on the wound and after few minutes enter in the body. If the bacteria stay in the body, they can cause an infection, such as tetanus, rabies, or sepsis. In some cases, an infection can spread to other parts of the body. People will need antibiotics or vaccinations to treat these types of infection. A dog bite can cause tetanus bacteria to enter the body. Symptoms of tetanus include 1. Cramping in the jaw, 2. Muscle spasms, usually in the stomach, 3. Difficulty swallowing, 4. Muscle stiffness. Tetanus is a serious infection. People with any symptoms of tetanus need immediate medical attention. They will require medications, such as antibiotics, as well as a tetanus vaccine. People can get rabies if a dog that has rabies bites them. The first symptoms of rabies are 1. A headache, fever, and other flu-like symptoms. 2. Weakness. 3. An itching or prickling feeling around the bite. Rabies is fatal if a person does not receive treatment. People should see the doctor straight away if they think that the dog that bit them might have rabies. Post-exposure rabies vaccination can treat the infection. Untreated animal bites can sometimes lead to sepsis. Sepsis is a severe reaction to infection, and it can be life-threatening. Signs of sepsis include 1. High or low body temperature. 2. Confusion. 3. Extreme daytime sleepiness. 4. Severe pain or discomfort. If a person suspects that they have sepsis, they should seek immediate medical attention. A doctor will treat sepsis with antibiotics and intravenous fluids. People may be able to avoid getting an infection from a dog bite if they wash the wound straight away. They can hold the wound under running water or use soap and water to wash it thoroughly before covering the wound with a bandage to keep it clean. For deeper wounds, the person should see a doctor, who will wash out the wound with a saline solution and apply a dressing. People should see the doctor straight away if they have any symptoms of infection around the wound, such as 1. Redness. 2. Worsening pain. 3. Warmth around the wound. 4. Swelling. 5. Oozing from the wound. If the person is at risk of developing an infection from a dog bite, a doctor may prescribe antibiotics to fight the infection. In some cases, people may need a tetanus or rabies vaccine to prevent these types of infection. People may be able to use at-home treatments to prevent a dog bite from becoming infected. Cleaning minor wounds immediately is often sufficient. However, people should see a doctor for more serious wounds. A doctor may use a syringe to apply water and a cleaning solution to the wound. Doing this helps flush out bacteria from the wound. The doctor may then prescribe antibiotics to fight off any bacteria that have entered the body and prevent infection. A doctor will also be able to examine the wound to look for any damage to structures in the body, such as nerves or bones. If the person has not had a tetanus vaccine in the last 5 years, they may need to have one to reduce the risk of tetanus. In cases of severe or facial wounds, people may need stitches to close the wound. If the person does not know the dog's history of rabies vaccination, they will need a post-exposure rabies vaccine to protect them from the possibility of rabies. Bites on the hands or feet carry a higher risk of infection. Certain infections from dog bites can be very serious and lead to complications. Without treatment, these infections can be fatal.